Hello, welcome back to another episode of Black Health. I'm your host, Dr. Kirwan Bythwood. I am a board certified pediatrician and chief medical officer. And today we're talking about a topic that is your considered bread and butter of medicine, high blood pressure. And although we all know somebody with high blood pressure, I feel like we kind of get used to high blood pressure as being a normal thing. I want you to learn today on today's episode how serious high blood pressure can be. And to learn, we will have with us today Dr. Adrian Burrows.
Hi, good
Dr.
morning.
Burrows, good morning. How are you? Welcome to Black Health.
Thank you. I appreciate you having me on.
Absolutely. I want you to take a moment and just quickly introduce yourself to our audience. Tell us a little bit about you, what you practice, what field you're in, and what you do in your day to day.
Thank you. So my name is Adrian Burrows. I'm a board certified family medicine physician. I've been blessed because I was on the White House Committee for Healthcare Equity. So I've been working trying to find um, uh, ideas and innovations to try to help people that are in poverty or people that are in groups that are underrepresented try to get a better relationship with healthcare. And so I am very, very happy to be here with you to talk about hypertension.
Thank you. Well, let's jump into it because this show does go quickly. What exactly is high blood pressure and why is it called the silent killer?
Okay, so I like to think of high blood pressure as the amount of pressure, the amount of force your heart has to work against to deliver blood to your body. And because the heart is a muscle, I always tell people that the higher that pressure, the more work the heart has to do to push the blood out. So that can make the heart get enlarged. And one of the reasons why we call it the silent killer, particularly in the African American population, is because a lot of times you don't feel anything. The pressure is rising and you have no idea that it's rising, but it can be doing damage in that time period.
What is systolic versus diastolic? So we have the top number, the bottom number. People often don't know what those mean or why they matter.
Sure. So the systolic blood pressure is your top number, and the diastolic blood pressure is the bottom. The systolic blood pressure is what we talked about earlier with the amount of force the heart has to push to send the blood out to the body. Whereas the diastolic blood pressure is the amount of pressure that impacts how the heart fills and relaxes. And so both of those things, when they're elevated, can cause damage in different ways to the heart.
So we talked about high blood pressure being a silent killer. You can also have symptoms of high blood pressure. So what are some of those symptoms?
Yeah, that's great. Great question. So when the blood pressure is really high, what you may feel is headache. Some people may feel dizziness. Some people may even get chest pain from that. But the symptoms that people don't notice that can be symptoms of high blood pressure is fatigue. One of the most overwhelming symptoms people have they don't realize are related to blood pressure is fatigue. They feel tired. They may have nosebleeds. These are things that may indicate that the pressure is running too high.
Dr. Burrows, as you're speaking, I'm thinking about, I actually have low blood pressure. I err on the side of low blood pressure, but I got into a car accident once and it was a road rage sort of scenario where a semi kept like hitting me deliberately. And the police came and talked to him first and they somehow determined that I was at fault. So I was, of course, livid and I was really angry. And I remember on the phone with my mom and for the next few days, I felt just funny. I felt like I described as like I'm coming out of my skin, like something, just something. And I finally went to the emergency room because I just like, this isn't normal. And it was high blood pressure. And I was really surprised. I didn't have headaches. I didn't have anything else. I just felt like I was just coming out of my skin is the best way that I could describe it. So I find in terms of it being the silent killer, sometimes we just, poo-poo away things like that, oh, I just feel funny. I just feel, but my blood pressure was significantly high at that time. So
Yeah,
what
and
are,
I'm
go
sorry.
ahead. No, go
And
ahead.
that's something that a lot of people experience. What happens is, we all have our day-to-day stresses, right? For me, if I didn't have stress, I don't feel like I was alive that day, right? So one of the things that can happen is that when you get stressed, your body releases something from your brain called adrenaline, and that adrenaline is a stress hormone. It's a way of helping you deal and cope the stress. Well, when adrenaline gets released, it makes the blood vessel, which may be this big around, clamp down. When it clamps it down, it helps to send blood to your brain so you can think through the stress. But the problem is when that vessel gets smaller, gets more narrow, that raises your blood pressure. And a lot of times you get so used to it when you're under a lot of stress, you're not being able to pay your bills, having issues with your family. Those are the things that raise your blood pressure, and you don't even notice because that's how you live day to day.
What blood pressure should somebody go to the ER? What is the number where you say systolic, diastolic, where, hey, you need to go to the emergency room?
Yeah, so that's a great question. So, if you look at the books will tell you 180 over 120. That those two numbers are when the top number is above 180, when the bottom number is above 120, those are the numbers that should prompt the concern that you should be evaluated. But I always tell people that your body doesn't read the books, right? So if your blood pressure is running high and you're feeling something with that, you're feeling a change in your vision, you're having headaches, your nose is bleeding, you're feeling chest pain or pressure, you're getting short of breath, you're feeling palpitations like your heart is pumping, you should get evaluated. That's the reality. And so the 180 over 120 are really hard numbers for when we think medically that you need to be evaluated. But if you're having a pressure that's elevated and having symptoms with it, you should definitely get evaluated.
What are some of the risk factors?
Oh, okay. So one of the risk factors for sure is family history. If you have a family history of hypertension or high blood pressure, that's going to make you more likely to have that. If you're having a weight that's above your ideal weight, being overweight or obese, those things can lead to high blood pressure. What you eat. So we're talking about me. I love salt. I love salt. Okay. So I put salt on everything. I put salt on apples, right? And don't follow my lead, whoever's watching out there. But those are things that when you have a lot of sodium in your diet, wherever salt goes in your body, water follows. So when you eat salt, the water follows that into your bloodstream, increases the amount of volume inside your blood vessels, and that makes your blood pressure run higher. If you're drinking alcohol, alcohol is a risk factor for your alcohol intake is a risk factor for this. And these are the things that if you're having these types of or having these types of activities, these can lead to that. Also, if you don't exercise a lot, that can also lead to high blood pressure.
How early can hypertension, high blood pressure begin?
Yeah. So the average person with high blood pressure is somewhere in the mid 40s because as you become older, your blood vessels become harder. We call it hardening of the arteries. And that just means that they're not as elastic. So they're more likely to generate force. And so the average person is like in the mid 40s. But the reality is you can have high blood pressure at any age. And so it's definitely something that we should try to screen for. I have a lot of kids that I take care of that have elevated blood pressures. And so it's something that we should definitely get into the habit of checking. Now, if you were to look on the internet, and I also people think that Google is a great doctor. Google's a terrible doctor, right? Because if you look on the internet, Google will tell you can check your blood pressure every 2 to 3 years. It's nonsense, right? That's something that should be something that you get into a routine of checking, especially when you're black, because being black is actually a risk factor for hypertension.
Yeah, yeah. We check blood pressure in children starting at the age of 3, and I check it every year. Every year. So for adults, I can't even imagine going 2 to 3 years. You rarely find high blood pressure in children, maybe some teenagers, especially in obese teenagers, maybe, and non-obese teenagers. But we check it yearly. I make sure we check it yearly. So what are some of the long-term consequences of untreated high blood pressure? I know I've spoken to several adults, and I only do pediatric care, but I have family members with high blood pressure that are like, nope, I don't want to take the medication. I'm gonna, pound the chest, thug it out, that kind of thing. And they don't want to take the medication. What are some of the long-term consequences if you do not do something to treat your blood pressure, high blood pressure?
Yeah, and this is one of the things that I see most often. There are lots of people who don't want to take anything for their blood pressure, and I understand that. So I always try to get people to make dietary changes to try to help that. But if we don't control your blood pressure, one of the primary things that can happen is it makes your heart bigger. And we had spoken earlier about the pressure being the amount of force the heart has to work against. So it's just like pumping weight, like doing exercise. Now you're adding the weight that the heart has to pump against. And so the heart's going to start to enlarge. So you're going to start seeing some signs of that. Your kidneys. So what your kidneys are very resilient organs, but they can only tolerate so much for so long. And especially in the Black population, we tend to have a little bit more kidney disease than other populations. And so we can see damage to the kidneys. Damage to your vision, that is definitely something that can happen. The blood vessels in the eye are much smaller. And so with that pressure being higher, we can cause a lot of damage, that can affect our sight. We have, one of the things I wanted to touch on that I think is very important is that, so when you go to your doctor and you get your blood done, they often do a panel of electrolytes, and that electrolyte panel will give you your kidney function, but it'll also give you something called a GFR. G stands for glomerular, which means kidney, and then the FR is a filtering rate. So there's a really weird equation that they have out there where they give you a GFR for non-African Americans and a GFR for African Americans. There's no physiological basis for this. This is one of the implicit biases in the healthcare system. And so what's been happening is that a lot of African Americans have been having issues with their kidneys, but the threshold is lower. So in other words, we don't identify early with this calculation. And then if you ever look in a dialysis unit, the majority of the people in the dialysis unit are Black, right? And so this is one of the things that I always tell my patients is to make sure that your doctor is understanding that there are biases in the system, so that you can make sure that you're not even if you are going to the doctor and having your checkups, to make sure that you're being cared for appropriately. So I tell people that there's a lot of organ damage that can happen from high blood pressure. We want to make sure we get you under control sooner rather than later.
We're going to take a quick break, Dr. Burrows. We need to take a quick commercial break. You are watching Black Health. Don't go anywhere. We are talking about hypertension, high blood pressure with Dr. Adrian Burrows. We'll be right back.
History? Yeah, we built that. Pride? We fuel that. And on August 30th, we run that. Two powerhouse HBCUs, Howard Bison, FAMU Rattlers, one legendary showdown under the Miami lights at Hard Rock Stadium. The energy unmatched. The culture undeniable. The vibes straight HBCU. Get your crew. You don't want to miss this. Lock in your seats now at orangeBlossomClassic.com.
Miami-Dade is filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Mesman & Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
In Miami-Dade, it's always that time of year, mosquito season. And they're an ongoing danger for our community. To protect yourself this season, follow these simple steps. Drain all standing water around your home and perform weekly checks on areas that accumulate regular buildup. When outside, make sure you cover up as fast as possible. Finally, never forget to use repellent on skin and clothing.
Dude, your mom is so weird. Get away. I know.
Together, we can fight the bite and keep our community safe.
School's almost back, but first, let's have some fun. It's the Children's Trust Family Expo, packed with music, shows, and back-to-school supplies. Join us August 2nd at the Fuchs Pavilion at Miami-Dade Fairgrounds. We'll even help you get there. It's easy with an Uber voucher, good for up to $15 each way. Free entry, free parking, free family joy. Visit thechildrenstrust.org/Family Expo for details. Let's go to the Family Expo. Uber voucher terms and conditions apply.
Welcome back. You're watching Black Health. We are talking about high blood pressure with Dr. Adrian Burrows. So, Dr. Burrows, you were talking about some of the long-term consequences of untreated high blood pressure. You mentioned several. Were there any others?
Yeah, so one of the things that we have heart disease, right? We talked about the heart enlargement, but actual heart disease can be a consequence of having your blood pressure not appropriately cared for. And unfortunately, when we start talking about the effects of hypertension, we can talk about your neurological um, um, status. So we can have higher risk of strokes. We can have higher risk of cognitive impairment. There's a bunch of illnesses associated with something called dementia, where you have memory loss that can be affected by high blood pressure. And for a lot of the men who I talk to who don't want to have anything done for high blood pressure, I tell them it can cause sexual dysfunction. And then all of a sudden they wake up, hey, wait, what?
The ears,
Right?
right. What do I need to
And I have
take? How often do I take it?
right. Right. I have their full attention at that point. I tell people that Viagra, which is what a lot of men have to use when they have sexual dysfunction, was not made for that purpose. It was made for hypertension in the lung system. And that's one of the reasons why it works. So I think that when I tell people that, they start paying more attention. Great question. So, this is simple. We can go to, you can go to your local grocery store and you'll see the little blood pressure cuff. You can stick your arm in there and get that done. You can go to the fire station and get that done. There are numbers that we determine when you have high blood pressure. Now, so depending on the agency that's giving the information, we tend to think 140/90 is roughly when we think you're having blood pressure issues. So the top number, the systolic, being above 140, or the bottom number being above 90. And that's when we would need to try to intervene by some method.
And then how do you intervene? What do you do? Is it
Yeah,
all
so
medications? You talked about diet and lifestyle. What can we do?
Yeah, I practice something called integrative health. So integrative health means that I do regular medicine, but I also do holistic medicine, right? So a lot of the times there are some patients that I have that are like, just give me the pill, let me take it. And there are some patients that are like, no, I want to try something else first. So I try to start with dietary changes, right? Low sodium diet. There's something called the DASH diet, which you can look up. It's called a dietary approaches to stopping hypertension. That'll give you the types of foods that you can eat, the amounts of the foods you can eat, the amount of salt that you need to limit yourself to try to bring your blood pressures down. Exercise. You start exercising, that'll help to bring down the weight, and in the process helping to bring down your blood pressures, right? Limiting the amount of processed foods. A lot of people drink soda. Sodas are full of caffeine. I used to be a big Mountain Dew drinker. One of the worst things you can take. Right. And so people have to have
that somehow.
Some people have to have their coffee. There are different things that we have to try to limit, to try to help with the high blood pressure. I don't want you to live a lifestyle where you're not happy with eating, because I'm a big eater. I love to eat. But we want to make sure we're making good choices and incorporating things that can help bring the pressures down.
And medications, are they different for Black people versus white people? Do they
Yes, they're
in both populations?
Yes. So I tell people it's not a cookie cutter design. We have to make choices for medications based on the individual. So there's certain classes of medications that tend to work better in Black people than others. One of those being like a diuretic. There's a chlorothalidone or hydrochlorothiazide. Those things work really, really well in bringing the blood pressure down in the Black community. And they also have a lot of evidence that shows that those medications can help prolong your life. There's another type of medication called calcium channel blockers, of which amlodipine is one that tends to work really well in Black communities, but the studies don't show that it helps to prolong your life as much. So really good at helping the blood pressure, not as much as prolonging the life. And so we want to make sure that we're making choices that help you, but also help you live longer.
What about aspirin? Does aspirin play a role here?
Yeah, so there's a lot of debate about aspirin. So my dad had heart transplant, right? So when my dad had a heart transplant in 2001, I immediately ran and started taking aspirin, right? Well, the data shows that aspirin, unless you have a real indication for it, like you have a certain problem that makes you need to have aspirin, doesn't really do as much for you. And it can potentially cause risk, bleeding and things like that. So I tell people if you're thinking about aspirin, make sure you talk it over with your doctor first to make sure it's a reasonable choice for you.
Awesome. We are again at that time where we need to take a quick commercial break. You are watching Black Health. Don't go anywhere. We will be right back with life-saving information with Dr. Adrian Burrows.
History? Yeah, we built that. Pride? We fuel that. And on August 30th, we run that. Two powerhouse HBCUs, Howard Bison, FAMU Rattlers, one legendary showdown under the Miami lights at Hard Rock Stadium. The energy unmatched. The culture undeniable. The vibes straight HBCU. Get your crew. You don't want to miss this. Lock in your seats now at orangeblossomclassic.com.
Miami-Dade is filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
In Miami-Dade, it's always that time of year, mosquito season. And they're an ongoing danger for our community. To protect yourself this season, follow these simple steps. Drain all standing water around your home and perform weekly checks on areas that accumulate regular buildup. When outside, make sure you cover up as best as possible. Finally, never forget to use repellent on skin and clothing.
Dude, your mom is so weird. Get away. I know.
Together, we can fight the bite and keep our community safe.
School's almost back, but first, let's have some fun. It's the Children's Trust Family Expo, packed with music, shows, and back-to-school supplies. Join us August 2nd at the Fuchs Pavilion at Miami-Dade Fairgrounds. We'll even help you get there. It's easy with an Uber voucher, good for up to $15 each way. Free entry, free parking, free family joy. Visit thechildrenstrust.org/Family Expo for details. Let's go to the Family Expo. Uber voucher terms and conditions apply.
Welcome back to Black Health. We are talking about hypertension. Dr. Burrows, you talked about lifestyle changes, smoking, alcohol. We've mentioned some of those things, the medications. There's a movement, it seems, towards being holistic and natural and herbal and these types of things. Are there any natural remedies or herbal remedies that you're aware of that help with high blood pressure?
Yes. So one of the things people ask me often is that question: what can I take that's not a pill? What can I do to help my blood pressure? One of the effective measures of doing that is with magnesium. So magnesium is a natural, smooth muscle relaxant, right? And so their blood vessels, your arteries, have muscles on either side to help control whether they constrict, get smaller, or get larger, dilate. And magnesium is very effective at doing that. And I tell people, when you're choosing magnesium, you got to be careful what you're buying. So magnesium oxide is a salt, and that's not something that you need. So magnesium glycinate works really, really well to do that. It helps relax the muscles. It helps lower the blood pressure. And the other issue I tell people, though, is that because it relaxes the muscles, it can make you really relaxed. So take that in the evening is what I tell my patients, right? But there's other things you can do to try to limit to lower the blood pressure. Things that so one of the things that we have to understand is that high sodium and low potassium are the things that make you higher for risk. So when you're eating potassium, substituting potassium, that helps to lower the blood pressure.
So I just want to make it clear, with magnesium and potassium, whatever you're doing there, you really need to be following with your doctor, correct?
Absolutely. I always tell people,
I don't think you can just, if somebody hearing this that doesn't want to take medication, can they just say, okay, I'm going to start magnesium and
Oh, no, no, no. People do all. I said people are taking super beats and all kinds of stuff that they find on TikTok, right? So no, these are not things that you need to be. Like I said, Dr. Google should be sued for malpractice because it gives people all kinds of terrible advice, right? So anytime you're having any issues with blood pressure, you need to be under physician supervision.
Okay. What are the biggest challenge your patients or clients face in managing hypertension?
Yeah, so getting back to talking about the cost, right? It's not easy or cost effective to be healthy, right?
Yeah.
Fast food choices don't often involve things that are healthy for you, and those are very convenient. So lifestyle wise, living in your work life, trying to make your money fit your budget, the cost of what we're trying to do here is not easy, and that's one of the bigger challenges. There's been a lot of skepticism about medicine in general. I'm talking about people feeling like the healthcare system is not for them, right? And so a lot of times they're being given advice and they're not sure whether they can trust the advice that they're being given. And I tell people to make sure that you're having a healthcare provider that you trust. Just don't go to the doctor to go to the doctor. Make sure you're going to someone that you trust so that when they give you recommendations, you're more apt to follow them. So those are some of the challenges that I see mostly are the cost of doing what we think is healthy, the cost of having medications to treat the diseases, and making sure that we're not, that we are trusting the information that we're receiving from the healthcare systems.
You mentioned insurance being a barrier or lack of access to care. If someone doesn't have insurance or doesn't have regular access to a doctor, what is the first step that they can take to monitor and manage their blood pressure?
Yeah, so that's one of our major challenges. So for people who can't afford insurance, and it certainly isn't cheap these days, I tell people you can go to the fire station. They can check your blood pressure and see what that is. There are several programs that you can either look up online or you can go to, like in my community, there are a lot of free clinics and things like that have medications. We donate medications to those places all the time, so we can try to get you on something. Until you find those things out, you can look up the DASH diet, the dietary approaches to stopping hypertension diet, and try to institute those changes. Those are safe things for you to do. But I would try to look to make sure that you have something in your community to see if you have any free clinics or any places where you can get medications for less money.
Great. Thank you. Dr. Burrows, that brings us to the end of our show. I think we did a very thorough dive into hypertension. Thank you for taking your time to be with us today. Thank you for your expertise. Thank you for your service to the White House on that panel. That's amazing. And
thank you for having me. And you look young as when I remember you from medical school.
Yes, for those watching, Dr. Burrows and I went to medical school together. So we've known each other for a lot of years. We're not going to say how many. Dr. Burrows, thank you again so much. Thank you for those of you that are listening, and we will see you next time on Black Health. Take care, everybody.
Thank you.